Hi, I'm Dr. Klein. I'm an orthopedic surgeon. I specialize in hip and knee replacement. I work at Virginia Mason Franciscan Health. It's really important to have a good connection and comfort level, bond with your surgeon. I like to think of it as a partnership. So I want my patients to feel comfortable with me. I want them to know that my goal is to give them state-of-the-art hip or knee replacement, literally cutting edge. Knee replacement, it's actually a resurfacing or recapping. We're recapping the ends of the two bones, the bottom of the thigh bone and the top of the shin bone. What's so nice about using the robotic arm is that I can customize the way I do one knee compared to the other, so I can get the knee so it's lined up just perfectly, get it so it's not too tight, not too loose, really the Goldilocks of perfect, basically. It's amazing. By far the most common reason patients need hip replacement is just arthritis, which is quite common, and that's just a fancy way of saying that the cartilage is wearing down both the ball and the socket side of the hip joint. We make a cut below the ball that's all worn out. I wedge what's called a stem. It's essentially a triangular wedge of metal down the top of the thigh bone or the top of the femur. The bone grows onto that. I attach a ceramic ball to the top of that stem. The ceramic ball replaces the ball that we cut out that's all worn out. For the socket side, we use a tool called reamers, and we carefully scrape away whatever is left of the cartilage, a little bit of the bone from the inside of the socket. And then I insert this cup that has a fancy titanium coating on it, and the bone actually grows into the back of that cup, just like the bone grows into the outside of the stem. To me, the job is not just about doing the surgery. The job is also about really connecting with the patients and making sure that they feel comfortable throughout the process and doing everything I can to try to help them through the process.